If you're over 60 and taking blood pressure medication, stop what you're doing and listen to this right now. What I'm about to tell you could save your life tonight. Your doctor told you high blood pressure is just part of getting older, right? That you'll be on pills forever? That's exactly what Big Pharma wants you to believe. But here's the truth they don't want you to know. Your blood pressure isn't high because you're aging. It's high because you're making one deadly mistake every single day, and it's slowly destroying your arteries from the inside out. A groundbreaking study from Johns Hopkins University tracked over 8,000 seniors on blood pressure medication for 12 years, and what they found was shocking. 67% still experienced major cardiovascular events despite taking their pills exactly as prescribed. The pills help, sure, but they're just covering up the real problem. And that problem? It's happening in your blood right now, every time you breathe. In this video, I'm going to reveal the 8 deadliest mistakes ranked from common to most dangerous that are silently depleting this protective gas from your body right now. And mistake number 1, it's something 89% of blood pressure patients do every single morning without realizing they're sabotaging their own treatment. Before we dive in, drop a comment and tell us what time of day your blood pressure spikes most and what you typically eat for breakfast. We're reading every comment and replying with personalized advice based on your specific situation. Now let's start with mistake number 8. And it's one that even cardiologists often overlook. Mistake number 8, the morning rush error. This mistake is happening in bedrooms across America right now, and it's triggering thousands of preventable strokes every single week. Here's what most people do. The alarm goes off. They jolt out of bed, stumble to the kitchen, and pour a cup of coffee within minutes of waking up. Sound familiar? This seemingly innocent routine is creating a perfect storm of cardiovascular stress that your body simply wasn't designed to handle. A landmark study from the University of Tokyo followed 6,400 adults for 8 years and discovered something absolutely stunning. People who consumed caffeine within 60 minutes of waking had a 63% higher risk of experiencing what's called orthostatic hypotension, a sudden dangerous drop in blood pressure when standing that often triggers morning strokes. Here's why this matters so much. When you first wake up, your body is in a delicate transition phase. Your cortisol levels are naturally spiking to help you wake up. Your blood vessels are adjusting from lying down to standing, and your heart rate is accelerating. This is already putting significant stress on your cardiovascular system. Now add caffeine into this mix. Caffeine triggers an immediate release of adrenaline, causes vasoconstriction in your arteries, and forces your blood pressure to spike even higher. Research from the American Heart Association shows this combination creates what they call the morning double surge, where your systolic pressure can jump 30 to 40 points in just minutes. But here's what makes this deadly. When you stand up too quickly during this surge, blood pools in your lower body. Your brain doesn't get enough oxygen. You feel dizzy, lightheaded, and in that moment, you're at peak risk for a stroke or heart attack. In fact, 70% of all cardiac events in people over 60 happen between 6 a.m. and 10 a.m., and the morning rush error is a major contributor. The fix requires discipline, but it's simple. For the first 45 minutes after waking, move slowly and deliberately. Sit on the edge of your bed for exactly 2 minutes before standing. Never drink coffee before 9 a.m. Instead, drink 2 full glasses of room temperature water. Not cold, not hot. Exactly room temperature within 10 minutes of waking. This hydrates your blood, reduces viscosity, and helps stabilize your cardiovascular system. And here's a critical warning. Never drink ice water first thing in the morning. Ice water causes immediate vasoconstriction, the exact opposite of what you need. A study from the European Heart Journal showed ice water consumption in the morning increased arterial stiffness by 22% within 30 minutes. Now let's move to mistake number 7. And this one is even more dangerous because it's disguised as healthy advice. Mistake number 7. The hydration lie. You've been told to drink 8 glasses of water a day, right? Stay hydrated. But here's what they're not telling you. The type of water you drink, and when you drink, it could be making your blood pressure worse, not better. Most people drink tap water, thinking they're doing their body a favor. But tap water in most cities contains chlorine and fluoride, chemicals specifically added for sanitation. Research from the National Institutes of Health found that chlorine in drinking water damages the endothelial lining of your arteries, the delicate inner surface that produces nitric oxide. Every glass of chlorinated tap water you drink is slowly destroying your body's ability to produce it. Here's the mechanism. Chlorine is a powerful oxidant. When it enters your bloodstream, it creates free radicals that attack the endothelial cells. Over time, this damage accumulates. Your arteries become stiff, your nitric oxide production drops, and your blood pressure climbs higher and higher. A study from Environmental Health Perspectives tracked 2,100 adults and found those drinking chlorinated tap water had 17% thicker arterial walls compared to those drinking purified water. But there's another critical factor: blood viscosity. When you're even slightly dehydrated, your blood becomes thicker, more like ketchup than water. This forces your heart to work harder to push blood through your arteries, spiking your pressure. A study from the Journal of Clinical Hypertension found that just 2% dehydration increased systolic blood pressure by an average of 14 points. The protocol is specific. Drink only filtered or purified water. Install a reverse osmosis system, or use a high-quality carbon filter that removes chlorine and fluoride. Drink exactly 16 ounces of room temperature, purified water immediately upon waking. Then, another 8 ounces every 2 hours throughout the day. Add a pinch of Himalayan sea salt to your morning water. This provides electrolytes that help your body actually absorb and utilize the water at the cellular level. And here's your critical warning. Never drink distilled water long-term. Distilled water is too pure. It actually leaches minerals from your body. Stick with filtered water that retains beneficial minerals. Before we continue to the even more dangerous mistakes, tell us in the comments. Do you experience dizziness or lightheadedness when you first stand up in the morning? And what kind of water are you drinking right now? Mistake number 6. The healthy fruit trap. This mistake is happening in kitchens across America right now, and it's sending thousands of people to the emergency room with what doctors call accidental drug overdoses. Here's the scenario. Your doctor told you to eat more fruit for heart health. So you start your morning with a fresh glass of grapefruit juice. Seems healthy, right? But if you're taking blood pressure medication, especially calcium channel blockers like amlodipine or statin drugs for cholesterol, that innocent glass of juice just turned your prescribed medication into a potential poison. A landmark study published in the Canadian Medical Association Journal tracked medication interactions for 7 years and found something absolutely stunning. Grapefruit consumption increased blood concentration of certain medications by 330% to 1,200%. Let me repeat that. 1 glass of grapefruit juice can cause your medication levels to spike over 10 times higher than intended. Here's why this is so dangerous. Grapefruit contains compounds called furanocoumarins. These natural chemicals are powerful inhibitors of an enzyme in your intestines called CYP3A4. This enzyme is responsible for breaking down over 60% of all oral medications before they enter your bloodstream. When you drink grapefruit juice, you essentially shut down this protective enzyme for up to 24 hours. Now here's what happens. You take your normal dose of blood pressure medication, but instead of your body metabolizing it properly, the full dose floods into your bloodstream at toxic levels. Your blood pressure doesn't just lower, it crashes. People experience severe dizziness, fainting, irregular heartbeat, and, in extreme cases, complete cardiovascular collapse. A study from the University of Western Ontario documented 26 fatal drug interactions directly linked to grapefruit consumption over a 5-year period. But here's what makes this truly insidious. The effect is cumulative and delayed. You could drink grapefruit juice in the morning and not take your medication until evening, and the interaction still occurs. Even eating fresh grapefruit sections has the same effect. Research shows just one whole grapefruit is enough to inhibit CYP3A4 by 47% for an entire day. The protocol is absolute. If you're taking any blood pressure medication, calcium channel blockers, or statin drugs, completely eliminate grapefruit from your diet. No juice, no fresh fruit, no grapefruit extract in supplements. Check labels carefully because grapefruit flavoring appears in unexpected places. And here's your critical warning. Pomelos, Seville oranges, and Tangelos contain similar compounds. Avoid these as well. Now we're moving into even more dangerous territory. Mistake number 5, the sodium deception. This mistake has been drilled into your head by every doctor, every health magazine, every government guideline for the past 40 years. And it's completely wrong. You've been told to cut sodium, eat a low-salt diet, avoid salt like it's poison. But here's the truth they're not telling you. Sodium isn't your enemy. The real problem is the catastrophic imbalance between sodium and potassium in your diet. And fixing this could drop your blood pressure more effectively than any medication. A groundbreaking study from the American Journal of Clinical Nutrition followed 12,267 adults for 15 years and discovered something that contradicts everything you've been told. People who restricted sodium intake below 300 milligrams per day while also having low potassium levels had 34% higher mortality from cardiovascular disease compared to those with moderate sodium and high potassium intake. Here's the mechanism your doctor never explained. Every single cell in your body contains something called the sodium-potassium pump. This is a microscopic gateway that controls blood pressure at the cellular level. For every 3 sodium ions pumped out of your cells, 2 potassium ions are pumped in. This creates an electrical gradient that keeps your arterial walls flexible and responsive. But here's what happens when you cut sodium without increasing potassium. The ratio becomes dangerously skewed. Your cells can't maintain proper pressure. Your arterial walls become rigid and unresponsive. Research from Boston University Medical Center showed that low potassium intake increased arterial stiffness by 41%, even in people with restricted sodium diets. The real killer is this. Most Americans consume 3,400 milligrams of sodium daily, but only 2,640 milligrams of potassium. The optimal ratio should be 4:1, meaning 4,700 milligrams of potassium to just 1,500 milligrams of sodium. When you get this ratio right, your blood pressure naturally regulates itself. The protocol requires precision. First, switch from refined table salt to unprocessed sea salt or Himalayan pink salt. Table salt is stripped of all minerals and contains anti-caking agents that damage arterial walls. Natural salt contains trace minerals that work synergistically with potassium. Second, consume exactly 4,700 milligrams of potassium daily from whole food sources. The best sources are avocados, sweet potatoes, white beans, and Swiss chard. And here's your critical warning. Never use potassium supplements without medical supervision. Supplemental potassium can cause dangerous heart arrhythmias. Get your potassium from food only, where it's naturally balanced with other minerals. Mistake number 4, the measurement sin. This mistake is happening in homes and doctors' offices millions of times every single day, and it's causing people to be prescribed medication they don't actually need. Here's what's happening. You sit down to check your blood pressure. Maybe you cross your legs for comfort. Your arm is resting on the armrest, hanging a bit below your heart. You're nervous because you're worried about the reading. The cuff inflates, and the number comes back high. Your doctor increases your medication. But here's the truth. That reading was completely wrong. A comprehensive study from the American Heart Association analyzed 200 blood pressure measurements taken in various positions and found something absolutely stunning. Simply crossing your legs while measuring blood pressure artificially elevates the reading by an average of 8 millimeters of mercury. Having your arm below heart level adds another 10 millimeters. Being anxious in a medical setting, called white coat syndrome, can spike your pressure by 20 to 30 millimeters. Let me repeat that because this is critical. If you're measuring incorrectly, you could be getting readings that are 15 to 40 points higher than your actual blood pressure. That means you could be taking medication, experiencing side effects, and spending money on pills you don't actually need. Here's why body position matters so much. Blood pressure is a measurement of force against arterial walls, and that force changes dramatically based on gravity and vascular compression. When you cross your legs, you're compressing the femoral artery, the major blood vessel in your thigh. This compression forces blood back up toward your heart, temporarily spiking pressure. When your arm hangs below heart level, gravity pulls blood downward, requiring your heart to pump harder to push blood upward against resistance. But there's another critical factor. White coat hypertension is real and dangerous. Research from the Mayo Clinic shows that anxiety during measurement triggers a stress response. Your adrenal glands release cortisol and adrenaline. Your heart rate accelerates. Your arteries constrict. The reading you get reflects acute stress, not your true baseline pressure. The protocol is precise, and you must follow every step. First, sit in a chair with back support. Your spine must be straight against the backrest. Never sit on an exam table where your back is unsupported. Second, place both feet flat on the floor. Never cross your legs, ankles, or knees. Third, rest your arm on a table or armrest at exactly heart level. Your elbow should be slightly bent. Fourth, remain completely still and silent for exactly 5 minutes before taking the measurement. During this time, practice slow breathing. Inhale for 4 counts, exhale for 6 counts. And here's your critical warning. Never take your blood pressure immediately after exercise, after drinking caffeine, after eating, or while talking. Any of these activities will spike your reading by 10 to 20 points. Take multiple readings separated by 2 minutes and average them together. Now we're getting into truly dangerous territory. Mistake number 3, the oxygen thief. This mistake is happening while you sleep, silently stealing oxygen from your brain and triggering heart attacks in the middle of the night. Here's what most people don't realize. The way you breathe while sleeping determines whether you wake up healthy or at risk for sudden cardiac death. If you're breathing through your mouth while you sleep, you're slowly suffocating your cardiovascular system. A landmark study from the Sleep Research Society followed 5,600 adults for 12 years and discovered something that should terrify anyone with high blood pressure. People who habitually breathe through their mouth during sleep had a 78% higher risk of nighttime cardiovascular events compared to nasal breathers. Here's the mechanism most doctors never explain. Your nasal sinuses produce about 25% of your body's total nitric oxide. Remember that protective gas we discussed earlier? When you breathe through your nose, every breath delivers a fresh dose of nitric oxide directly into your lungs and bloodstream. This keeps your arteries dilated and flexible throughout the night. But when you breathe through your mouth, you bypass this entire system. No nitric oxide production occurs. Your arteries gradually constrict. Your blood pressure climbs by 3 or 4 mmHg. When your cortisol naturally rises to wake you up, your blood pressure can spike to dangerous levels. This is why most heart attacks occur between 3 m and 6 m. There's another devastating factor. Sleep apnea and mouth breathing go hand in hand. When you breathe through your mouth, your tongue falls backward, partially blocking your airway. You experience what researchers call silent choking, brief episodes where oxygen levels plummet. Each episode triggers a stress response that spikes your blood pressure. The fix is unconventional but remarkably effective. It's called mouth taping, and while it sounds extreme, research backs it up completely. A study from Stanford University showed that mouth taping during sleep increased oxygen saturation by 8% and reduced nighttime blood pressure spikes by 34%. Here's the protocol. Purchase medical-grade paper tape, not duct tape or plastic tape. Before bed, close your lips and place a small strip of tape vertically across your mouth. Start with just 1 hour to acclimate, then gradually increase. Within a week, you'll naturally transition to nasal breathing throughout the entire night. And here's your critical warning. If you have severe sleep apnea diagnosed by a doctor, do not attempt mouth taping without medical supervision. You need a CPAP machine first, but for mild mouth breathing, this simple technique could save your life. Mistake number 2, the emotional poison. This mistake is invisible, silent, and deadlier than any dietary error we've discussed so far. Here's what most doctors won't tell you. Your emotions are directly wired to your cardiovascular system through your adrenal glands. When you hold on to chronic anger, resentment, or experience prolonged loneliness, your body treats it like a physical attack. A comprehensive study from the American Psychosomatic Society followed 8,900 adults for 18 years and found something that should fundamentally change how we think about blood pressure. People who reported chronic anger or social isolation had a 47% higher risk of developing resistant hypertension, the kind that doesn't respond to medication. Here's the mechanism. When you experience sustained negative emotions, your adrenal glands continuously release cortisol and adrenaline into your bloodstream. These stress hormones trigger vasoconstriction, forcing your arteries to constrict. Over weeks and months, this constant constriction damages the delicate endothelial lining of your blood vessels. The same lining that produces nitric oxide. But there's another devastating effect. Chronic stress depletes magnesium from your cells. Magnesium is essential for relaxing arterial walls. Research from the Journal of Hypertension showed that people under chronic emotional stress had 23% lower cellular magnesium levels, directly correlating with elevated blood pressure. The protocol requires both physical and emotional intervention. First, practice what's called coherent breathing. Inhale for exactly 5 seconds. Exhale for exactly 5 seconds. For 10 minutes twice daily. Studies show this resets your autonomic nervous system and can lower blood pressure by 8 to 12 points. Second, address isolation actively. Research proves that meaningful social connection for just 30 minutes 3 times per week reduces stress hormones by 34%. And here's your critical warning. Never suppress emotions. Suppressed anger is more dangerous than expressed anger. Talk to someone. Write in a journal. Seek professional help if needed. Your emotional health is inseparable from your cardiovascular health. Now, we've reached the most important mistake of all. Mistake number 1, the nitric oxide deficit. This is the master key that unlocks everything we've discussed. Fix this one thing, and you address the root cause of your high blood pressure. Here's what's happening inside your body right now. After age 40, your endothelial cells, the ones lining your arteries, lose about 50% of their ability to produce nitric oxide naturally. This is the single most important molecule for cardiovascular health. Nitric oxide signals your arterial walls to relax and dilate. Without adequate levels, your arteries become rigid pipes, and your pressure climbs relentlessly higher. A landmark study from the National Institutes of Health, published in the journal Circulation, tracked 4,200 people over 15 years and discovered something absolutely revolutionary. Participants who consumed high nitrate foods daily reduced their risk of cardiovascular events by 39% compared to those with low nitrate intake. Here's why this works. Certain vegetables contain naturally high levels of dietary nitrates. When you eat these foods, bacteria on your tongue convert the nitrates into nitrites. Your stomach then converts nitrites into nitric oxide. This dietary pathway bypasses your declining natural production and floods your system with the exact molecule your arteries desperately need. The number one food for this effect is beetroot. Beets contain higher concentrations of dietary nitrates than any other vegetable, approximately 250 milligrams per 100 grams. A study from Wake Forest University showed that drinking beetroot juice daily for 4 weeks lowered systolic blood pressure by an average of 11 points, comparable to many prescription medications. But here's what makes this truly powerful. The effect is dose-dependent and timing-dependent. The protocol is precise. Consume 500 milliliters of fresh beetroot juice or 200 grams of cooked beets exactly 2 to 3 hours before your blood pressure typically peaks. For most people, that means mid-afternoon. The nitric oxide production peaks exactly 2.5 hours after consumption and remains elevated for 8 to 12 hours. You can also use arugula, which contains 480 milligrams of nitrates per 100 grams. Create a simple protocol, blend 2 medium beetroots with 1 green apple, 1 lemon, and a thumb of ginger. Drink this exactly 90 minutes before dinner. Or make a salad with 3 cups of arugula, 1 tablespoon of olive oil, and a squeeze of lemon. The vitamin C in lemon enhances nitrate conversion. And here's your critical warning: never use mouthwash. Antiseptic mouthwash kills the beneficial bacteria that convert nitrates to nitrites. Research shows regular mouthwash use can increase blood pressure by 3 to 5 points by disrupting this pathway. Listen, you don't need to fix all 8 mistakes immediately. That's overwhelming and unnecessary. Start with mistake number 1 today. Add beetroot juice or arugula to your diet this week. Within 10 days, you'll notice a measurable difference in your readings. These mistakes compound on each other when you make them, but they also work synergistically when you fix them. Each correction makes the others more effective. Now I want to hear from you. What's the highest blood pressure reading you've ever recorded? And which of these mistakes do you think you're making right now? Drop your answer in the comments below, and let's figure out together which fixes will help you most. Thank you for watching.